So just a few take-home points regarding ulcers, corneal ulcers, okay? So I think it's very true with the corneal burr. Whenever we have a new tool, we want to use it for everything. And it's really important with the burr, and this is one of the things I'll stress from today, is you need to choose the case carefully. So if a young dog has an ulcer that's not healing, it's not going to get better if you burr it or do a keratotomy. If a young dog has an ulcer that's not healing, there's a specific reason for it. It's got an ectopic cilium, it's got distichiasis, it's got entropion, it's got a foreign body. And when I say young, we're saying sort of less than 5 years, okay? If you have a middle-aged dog, i.e. over 5 years, with a superficial non-healing ulcer, that is the case we need to do a keratotomy on, and I'll talk about why that is. And that's just a really important take-home point from today. A little bit about cats. Generally speaking, all cats in my opinion have herpes, and pretty much all cats with eye problems are related to herpes in some form or another. And then the final point, which is slightly off remit for today. So if you have a pug or a brachycephalic, you need to manage that ulcer very differently to if it's not one of those breeds. The reason being, these ulcers progress. They're very prone to getting infected. And if you don't treat these ulcers aggressively, you're going to get the cornea deteriorating rapidly, potentially perforating, potentially losing the eye. The deeper ulcers in these brachycephalics are not for a burr, they're not for a keratotomy. Okay. So the main focus of this lecture and the practical for the keratotomy, for the burr, are these middle-aged dogs with these indolent type ulcers, SCEDs, REEs. So this is just a slide, again, on the same tack about ulcers in general. So we need to identify and remove any underlying cause. Is there a grass seed? Has it got entropion? Is there an extra eyelash that's rubbing? Has the owner been using Maxitrol at home and not telling you? So all these things you need to try and identify. The signalment is important. So if it's a young dog, like I've already said, it's probably got some adnexal issue. It's probably got entropion, an ectopic, a clump of distichia that are causing an issue. If it's an middle-aged to older dog, it's probably got this classic indolent ulcer, which is what we're going to sort of focus on today. And if it's a cat, think about herpes virus. I don't know if any of you have ever had an ulcer or scratched your cornea. It's really, really, really painful. And I think we often forget that when we're treating these patients. So always give them some sort of pain relief. I once heard a story of a vet sort of telling me they'd read somewhere that systemic non-steroidals shouldn't be used in ulcers. I think that's wrong. I think systemic non-steroidals, assuming the animal is able to tolerate that drug, it's really important that we do use pain relief in these patients. Topical local anaesthetic. Again, when you're trained at vet school and in the textbooks, they should say you shouldn't really use it in ulcers, which I agree with, because it does delay the healing and it could cause the ulcer to get worse. However, if you've got an animal that's really, really painful, it's trying to rub its eye, the owner can't medicate the eye, actually doing a bit of local anaesthetic is really useful, a bit of proximeticaine. The beauty of the proximeticaine vials, which is the local I recommend, it's a tiny vial, so if you give that owner one vial, they can't do too much damage with it because it's only one vial and it will run out quite quickly. So don't be afraid of dispensing proximeticaine. The caveat being, don't overdo it, but it can be really useful, especially if you've done a procedure after the burr, you're sending them home, they're quite sore, and the owner wants something just to give them that evening, the next day, until things start to settle down a bit.